Thank you for joining Consumers Doctor, Dr. Bengala. In the last episode, I was talking about investing in Americans. Yes, US government has been spending $3.7 trillion for healthcare, which comes to around $10,000 for each American they're spending on the healthcare. If the representatives from the Congress, Senate, and even the President of the United States seriously gives they need to think about how we can save. It's worthwhile to invest in Americans and you'll get a good return. I will show you how. 160 million blue collar workers, they already have health insurance. Let's reform the health insurance program by itself by instead of having a traditional health insurance, have deductible health plan with lower premiums. The money saved is mandated to put aside into personal care accounts, so-called health savings account. If a blue-collar worker puts aside every year, I'm sure if the premiums are lower, he will save at least $4,000 to $5,000 every year. So a portion of that premium will be put aside into personal care accounts. Can you imagine in 10 years it'll be 50 to 60, 20 years it'll be 100 to 120, and it is invested accordingly, and that's going to grow over a period of time, and in 30 years you'll have 180,000. So that money can be used only for healthcare. So 160 million blue-collar workers will go a long way for their health coverage. Not only that, when they have a deductible health plan, the demand for the healthcare is not the same. People have to be more responsible. I'm sure everybody wants to save, and they will take care of their health, they will be physically fit, and they will try everything in their power to cut down the expenses in healthcare. The demand will go down, the cost will go down, and there will be more competition in healthcare. So by empowering the consumers, country will come out way ahead, and the healthcare budget overall, 160 million people are already subsidized by the employers. So this doesn't even include the government subsidized programs. Next one is 70 million Americans who are in Medicare. I am not sure what Health and Human Services or representatives in our Congress are thinking, but the way I see it, the Medicare needs to be they're giving the full risk contracts to few middlemen. Like I've seen healthcare doctors managing full risk contracts. Some of the high risk plans are called managing full risk contracts. That's a risky proposition. Why don't you invest the same money what you're putting into these managed care organizations into seniors? Invest that money, same thing what you're giving it to the middlemen, managed care companies, or full risk contractors. There are quite a few doctors who are managing full risk contractors. Why didn't you? They need to look into giving that empowerment to the seniors, to the consumers. If you give that responsibility to the seniors, I can bet you they can handle the healthcare a lot better. They will not abuse the healthcare, and they will save every penny what they can, because you're empowering the consumers, and they have to shop for the healthcare to save money. Whatever the funds you are giving it to the managed care, I'm sure they can buy a catastrophic insurance coverage for 40% of the revenue, and the other 60% you can put into the personal care accounts. Am I being straightforward? Instead of Health and Human Services investing into the mid-level agencies, managed care plans, full risk contractors, invest that same money, what you're giving it to them, give it to the seniors. If it's $1,000, $1,200, whatever it is, each senior can get a catastrophic coverage themselves with a lower premium, with a deductible plan, and put money, a portion of the money aside into the personal care or health savings. That will go a long way. That will not only have a choice for the seniors, they can see whomever they want. They will see their own doctor. They will pick up their own. You don't need a prescription drug plan. You don't need a managed care. You don't need billing. There are 9,000 billers. Come on, folks. 9,000 billing companies spread across the world, billing the Medicare and private insurance carrier. Do we need all that? We can get rid of these billing companies. Empower the seniors. That will reduce the cost, and pay as you go. There's no more billing. You pay as you get the care. Seniors know, I'm sure, if everyone has health savings and personal care accounts, they'll be careful. They'll pinch a penny as far as the spending money is concerned. Even for the drugs, prescription drugs, they should be able to get a better plan on their own at a lower cost, including generic drugs. They can buy generic drugs wherever they want. They don't have to be tied to one particular. They can buy the generic drugs anywhere they want. You don't need a prescription drug coverage. As far as the same thing goes with the Plan F, Plan K for the nursing home and senior facilities, residential care facilities, they should be able to use portion of the money for when they reach to a certain, they need caregivers. They can use that money. And it's a better investment for seniors. Right now, seniors are strapped with managed care plans. They have no choice. There's no coverage for pre-existing. Once you empower the seniors, the question of pre-existing coverage doesn't even arise. Question of prescription drugs doesn't even arise. And the thing is, you're giving freedom to the seniors. They can choose their own physicians, their own pharmacies, their own ancillary facilities, and I'm sure seniors will access the healthcare blue book. I'm not sure how many of you know healthcare blue book will give you the drug prices and treatment plans, the surgery costs, everything is according to the area code. Healthcare blue book, folks, look into that. That will give you a lot more information about the cost of the delivery of the care according to the zip code. Yes. The third thing is, This is the most critical part of the thing is people who are unable to take care of themselves, low income group, impaired, uninsurable group. This is where the government needs to focus and invest money in the Americans and the handicapped, disabled, and including the veterans who are disabled. Veterans have a coverage themselves, and I'm sure veterans also need the same thing like government subsidy programs. Give them empower them so to take care of their own health. When it comes to this third category, the impaired group, uninsurable group, low income category, disabled group, government has to focus on them. That's what they need. You don't have to mandate the rest of the groups because employer subsidized group is fine, Medicare subsidized is fine. Main focus has to be on the low income category where people can't afford. And if even when they get the EBT cards, you can empower the low income group. There are ways to empower them so that way they can improve their own, not only their health, by giving them the option of savings and incentivizing to take care of their own health. They would love to save money. I don't know what is a better option than keep wasting money. The success of the investment is mostly when it succeeds in the lower income category. That is the main thing, is focuses on the lower income, disabled, uninsurable group. If we can give them a guaranteed coverage, Health Review Authority can give a certificate of guaranteed coverage. Once they issued a certificate of guaranteed coverage, private health insurance plans will love to take care of that. And it benefits them by participating and taking care of the folks in the guaranteed coverage group. If they don't participate, the insurance companies are the losers. So once you have a certificate of guaranteed coverage by the Health Review Authority, which is a public-private partnership, it goes a long way. And I've been talking about obesity. It's a common problem in our country. By not being responsible in diet, fitness, health management, there are a certain group of people, they are not least interested in their own personal health, but once you incentivize them, believe me, they will change their habits. Personal responsibility becomes the main focus. I think I would love to see personal responsibility play a big role in overall health coverage for all Americans. I'm counting on savings, the $3.7 trillion which US government is spending will go down to maybe $3 trillion. And the demand and the competition, transparency, affordability, everything is empowered to the consumers, Americans. This Affordable Care Act has nothing to do with affordability or health care. It has nothing to do with it. It is all about freedom, folks. This so-called Affordable Care Act is a misnomer. It is, it sounds nice. It doesn't do anything other than government mandate. I would rather empower the Americans. I believe in Americans more than anybody else. By empowering the average low-income folks, America will not only be number one. As I was saying, Affordable Care Act is nothing to do with healthcare. It's all about freedom. As Abraham Lincoln said, this country, America, can never be invaded from outside. It will be if we falter on freedom. This is one of those things, folks. Healthcare is so critical for the country. By empowering the Americans, America will be number one. America will be a shining city all over again, as Ronald Reagan has said. Thank you for joining the Consumers Doctor channel. Please do make some comments, and I'm looking at going live and trying to address the same issue over and over, as long as everybody gets it. Hit the notification button and subscribe to this channel, folks. Again, thank you for joining Consumers Doctor channel. See you in the next episode.